If you've ever heard someone say they have a slap tear and had no idea what they were actually talking about, you're not alone. It sounds intense, and in some cases it can be. But today, I'm going to break down what a slap tear really is, why it matters for baseball players, how it happens, and what recovery looks like.
Welcome back to the Mound Ready podcast, the show where baseball players, parents, and coaches learn how to protect their arms, build real strength, and get back to dominating on the field. I'm your host, Dr. Dominic Rangel. Let's jump into today's episode and get you one step closer to being Mound Ready.
What's going on, everybody? I'm Dominic Rangel, and I'm a physical therapist in San Antonio, Texas. The first thing that we're going to talk about is, what is a slap tear? SLAP stands for superior labrum anterior to posterior. It's a type of labral tear in your shoulder. The labrum is like a rubbery bumper that surrounds your shoulder socket and helps stabilize the ball of your shoulder joint. It works like a suction cup. It's like to deepen the socket, since the actual joint is like a golf ball on a tee as opposed to a true ball in socket. Slap tear specifically refers to damage at the top of the labrum where the bicep tendon attaches. And that's important because when you throw a baseball, that biceps anchor takes a ton of stress, especially during the late cocking, layback, and the follow-through at ball release. Now, what are the most common symptoms? Most players don't wake up one day and just know they have a slap tear. It usually starts with some type of vague shoulder pain during or after throwing, maybe some clicking or popping, or just a sense of weakness or loss of velocity. This doesn't mean all clicking and popping is a labral tear. Let me just make that clear right away. Sometimes it feels fine when you're lifting, but starts to flare up when you try to throw with intensity. And over time, it just doesn't go away. Well, how does it happen? This isn't usually a one-time trauma, unless it's from a dive or a fall. In throwers, it's typically from repetitive stress. We call it acquired laxity. Think high volume throwing, poor shoulder control, limited scap stability, and high intensity because of max velocity in training. If your mechanics are off, or you're overtrained without enough recovery, the tension builds up in the biceps anchor, and eventually, boom, you've got a tear. There are actually two theories for how this happens. One is believed to be at layback due to something called a peel-back mechanism, where the biceps peels the superior labrum off the bone. And the other is tension, where the bicep rips the labrum off the bone as it attempts to keep your arm from flying out of socket as the ball releases. Either way, throwing is what causes it. Now, how do you get a diagnosis? We typically suspect a slap tear based on your symptoms and the movement screen, but the only way to really confirm it is through imaging, an MRI with contrast. But not all slap tears are created equal. Some are minor and respond well to rehab, while others are more complex and might require surgery, especially if you're not progressing or you're an elite level thrower. Honestly, there's a big portion of baseball players that are asymptomatic, meaning they don't have pain and they show some labral tear on their imaging. So we can't say for sure the labral tear is always the cause of the pain that you're feeling. So can you return to play? Yeah, for sure. Many pitchers return to throwing after a slap tear, but it all depends on the tear severity, your training plan, how well you're managing workload, and your mechanics. Rehab focuses on improving shoulder stability, scapular control, mobility, eccentric strength, and restoring timing in your throwing mechanics. We have checkpoints called KPIs that give us a good idea where you are in the timeline and how close you are to stepping back on the mound. We don't just chase pain relief. We build function, control, and power. That's the difference between feeling okay and being game ready. So if you're dealing with nagging shoulder pain and wondering if it could be a slap tear, don't ignore it. Get assessed early, catch it before it becomes a bigger issue, and build a plan to get back stronger.